On December 31st, 2019, the World Health Organization was informed of dozens of cases of pneumonia of unknown cause amongst Chinese citizens in the city of Wuhan. Unbeknownst to the vast majority of college students about to return to school in the United States, this illness would eventually grow to become the pandemic that is COVID-19. 21 days later, the United States reported its first case of the coronavirus in Washington state, and by the end of January, 25 additional countries outside of China would have reported the presence of COVID within their borders. Growing concern regarding the seriousness of the virus had not yet reached the point, however, to spur widespread preventative measures in the United States, in contrast to the more systematic responses organized by countries such as Germany and the Republic of Korea. By late February, the CDC announced COVID-19 was heading towards pandemic status, and the number of cases in the US had begun to rise. While many universities in the US did not yet respond to this, on March 7th, the University of Washington marked the first large school to close and send students home due to COVID-19. Discussion of the closure of more schools spread, while stores saw a panic rush for toilet paper, hand sanitizer, and other cleaning products.
In March, most students were sent home from their schools to start e-learning. At this point in the United States, masks were only recommended for healthcare workers, and according to Taejun Kang from The Diplomat, South Korea struggled with the mask shortage, causing less wearers. According to Madeline Chambers at Reuters, Germany recommended masks but did not enforce them. In April in the US, e-learning continued for students and certain states went on lockdown, but masks were not compulsory. According to Kar Kang Chang from The Lancet, in South Korea, there was a mass public adoption of masks, and according to Fred Pleitgen and Nadine Schmidt at CNN, Germany made masks compulsory, including fines for not wearing them.
According to the Centers of Disease Control and Prevention, the United States reached and surpassed 100,000 deaths from COVID-19 on May 28th. CNN reported by the end of May, only 15 states had mask requirements in public areas. After Germany mandated masks in public in late April, the number of positive cases reported was lower for the month of May. By the end of June, only 20 states in the U.S. had mandated mask wearing in public. Cases continued to rapidly increase while other countries were slowing the spread of the virus. According to researchers at Seoul National University Bundang Hospital, South Korea had a high percentage of its population wearing masks.
These are the total confirmed cases as of July 12, 2020. According to the World Health Organization, the cases in Korea and Germany occurred in clusters, while the U.S. had clear community transmission. This suggests that the U.S. had less control of the virus than other countries while reopening. While mask policies in the U.S. became more abundant during this time, the high volume of cases is an indicator that many in the U.S. weren't following these guidelines.
In the past couple of months, we have seen other countries that have enforced mask wearing, such as South Korea and Germany, have experienced a lower growth rate in cases compared to the United States. The science behind their choice to enforce mask wearing is that social distancing is not a cure-all fix to the virus. According to Anthony Paulo Sanjaya and Christine Jenkins of the George Institute for Global Health, particles are able to travel 7 to 8 meters, which is much farther than the 6-foot social distancing requirement, and it has been proven that particles containing the virus also stay in the air for an extended period of time. Masks are able to stop the spread of particles, which helps to contain the virus from inside the mask of someone who already has it. Other countries have had great success in controlling the virus due to their mass adoption of masks, which is an area where the US has fallen behind greatly. Even though masks can be a burden and most people do not enjoy wearing them, studies have proven that the most effective way for the United States to get back to normal society is for our citizens to wear masks.